New at noon, September is National Suicide Prevention Month, and the suicide rate for veterans is 1.5 times higher than the general population, but help is available for our veterans. And joining us now is Lieutenant Colonel Davis Morris, the State Support Chaplain for the Mississippi National Guard. How are you doing, Lieutenant Colonel?
I'm great. I'm great.
Well, thank you so much for joining us here. You are based in Jackson, but you drove all the way up here to be with us today because this is such an important topic for you. What is it that you would like to tell our military community?
Well, I'd like to tell our military community that, you know, everybody can receive help, because a lot of times people feel like they're stretching at straws to try to find somebody to be able to help them. We got the National Suicide Prevention Hotline, which is 988. So every soldier can be able to pick up the phone and call 988. It's our national suicide prevention number. Not only that, we do have Military One Source that each member can be able to get online or call that number when they get online. Mm-hmm. And we have someone, Dr. Famika Thomas is also our person in the state that handles all Mississippi Army National Guard calls. And I'm fortunate enough to be able to be in the same office with Master Sergeant James Huffman, mm-hmm. who is our Resiliency, Risk Reduction, and Suicide Prevention Officer. So we work hand in hand together to be able to work towards each other.
When you hear about the military suicide rates compared to that of the general population, how concerning is that for you? But most importantly, it's so alarming.
Well, I've been a chaplain for 14 years, and it's every suicide is very difficult for us because we want to always be there and be supportive of everybody that's being affected. And I've known several people affected myself that came back from a deployment and suicided, and it was very painful to watch.
Mm-hmm. And besides telling them about the help that's available, what else would you like to let them know?
Well, one thing that we do in the Army is called the Assist Workshop, and we give a model called the Pathway for Assisting Life. And one of the things that we try to do is we help soldiers and those that are a person at risk as caregivers ourselves to help them understand and connect with suicide by exploring invitations, by absolutely asking them the question of what suicide means, and what asking that very direct question. And then we try to understand their choices by hearing their story, by actually listening, active listening, to be able to hear the pain and the things they're going through in their life, and eventually helping them to find their own turning point, mm-hmm. to be able to find where they can assist life in that phase, and eventually to understand their choices of developing a safe plan and being able to help them confirm their actions of how they're going to be safe for now.
All right. Well, thank you so much, Lieutenant Colonel David Morris, for being with us today. Well, still